Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about Sever's disease, or Calcaneal Apophysitis. And as with all the other common problems that we're running into, we're going to actually answer the 4 questions. Number 1, what is Sever's disease? What is Calcaneal Apophysitis? I actually prefer the second name more because it sounds cool. Calcaneal Apophysitis is an inflammation of the apophysis, or physis, or growth plate, of the calcaneus, which is the heel bone. And this usually occurs in individuals when they're active. So if they're running or jumping or those kind of things, they actually get a pull of that growth plate from the heel, and you get an inflammation, pain, and pretty good discomfort. This is usually a common problem in growing children. If you have a child and they're under 17, 18 years old and they're having pretty significant heel pain, usually this is the problem. And so that's kind of the issue. So this is Calcaneal Apophysitis, inflammation of the growth plate of the calcaneus. And it's because of the pull of the Achilles tendon. Why does it happen? Number 2, why does this problem occur? The most common reason is rapid growth and high levels of activity. So it's going to be seen in runners where you get a pull on that growth plate, it gets inflamed, painful, and tender. We used to only see it in soccer players. We're now seeing it in football players, basketball players, baseball players, softball players, soccer players, gymnastics, dance, all because they're at higher levels of activity. And what you're doing is, because of how you walk, because of how they run, they get enough pull on that Achilles tendon to cause inflammation or injury or irritation to the calcaneus, or the heel bone in that area, in the apophysis. So it's a problem of activity and growth where you're actually just getting stress on that growth plate. Number 3, how you treat it at home. Truth is, there are only a couple of different ways that it can be treated. One is you can say, okay, I'm just going to limit activities, which is not a good option. You can do ibuprofen because it's an inflammation. You can do ice. You can really, those are really the big 3 that you can do at home without being seen by a doctor. I do recommend that you be seen by a doctor if you're saying, okay, this is hurting pretty bad. And there are a couple different directions you can go. One is just a simple plastic heel cup. The advantage of it keeps the Achilles tendon from pulling away on that growth plate, and it pulls the fat pad back underneath to pad it. Number 2, you can go into custom orthotics, orthotics that will cup the foot, change the way they walk, and take the pressure off that heel. It is usually in that order. You try the heel cup. If it works, and it usually does, you can actually completely resolve the problem. If it doesn't, you progress to orthotics. The idea is to allow the individual to continue to be active, continue to do what they want to do, and still resolve the Calcaneal Apophysitis. This is Dr. Brandt Gibson.